Now, skin disease is one of the common human illnesses, and it pervades all culture, gender, and age. About 70 or 30 to 70% of people suffer from different kinds of skin diseases. And we're talking about skin cancer, rashes, allergy, acne, and so forth. So today our topic of discussion will be on skin care routine, and we will be taking you through, we will talk about all there is about skin care, from the bad habits to the good habits for caring for your skin. And we will also be demonstrating here live Hydrafacial exercise, which involves cleansing of your face. We have important guests. We have Dr. Pranav Pancholi, and we also later will be joined by Carol. She is a dermatologist, and they will be basically be looking at some of the ways to prevent and even care for your skin. Just talk to us. The SMS line will be free of charge, 20268, and the call line will be displayed throughout this show or at the bottom of your screen. My name is Purity Musel, and you're watching my Dr. Show. But just before I could ask you to sit back, relax, and learn from this exciting show ahead, let's have a look at what's coming up.
The Hydrafacial.
And welcome back. You're watching my Dr. Show, and my name is Purity Musel. Today we are talking about some of the skin care routine, and as you can see in studio is a team of experts. We have Dr. Pranav Pancholi, and he is a dermatologist. He will be taking us through some of the skin care routine that we have. We also have, okay, this is a demonstration team. You will be having that shortly, but I will just ask you to talk to us. The SMS line is free of charge, 20268, and the call line is displayed right at the bottom of your screen. Now we want to, or just to help me welcome our special guest today, Dr. Pranav Pancholi. Thank you so much for having you, or for accepting to have you in our show today on my Doctor Show, even as we look at something really important, skincare routine. And thank you for coming, ladies. You all welcome.
Yeah. That's Eunice. She's one of our lead therapists at Avenue Clinic, and it's actually a pleasure for us to be here and to demonstrate the Hydrafacial system and how it works to take care of your skin for you.
Okay. And Doc, before we get to demonstrating on the Hydrafacial machine, why is it important? Why do you feel it's important for everyone to care for their skin both? And maybe you could tell us, should it be only a woman's affair, or even men? It's important for them to have a look or care for their skin.
Oh, everybody needs to take care of their skin, men, women, and the earlier you take care of your skin, the better it is, because it's going to prevent anti-aging, it's going to prevent dark spots. Even when you go into your 50s, 60s, 70s, you want to have a smooth, flawless skin with a good tone, a good texture, and nice and tight. So one of the ways of doing this is by servicing your skin. Yeah, just like every 5,000 kilometers, we need to take our car for a service. We need to service our skin as well, and that can be done through the Hydrafacial MD, which is a medical facial system. And I can go ahead and show you how it works if you like.
Yes, and just before we get to it, maybe for men who are watching, they're like, this is a woman's affair. Is it really a woman's affair, or do we have some of these skin conditions that are caused by bad skincare habits?
A lot of these are caused by bad skincare habits. A lot of ladies have habits of going to Mombasa House and getting all these mkorogos and things like that, which leaves their skins quite damaged. So yes, it's for ladies, but it's also for men who want to take care of their skin. We have a lot of lawyers, a lot of politicians, a lot of strong men that come in to get their cosmetic treatments done. And in the West right now, 20% of men perform cosmetic treatments. In Kenya, I would say it's around 5%, but the number is rapidly growing. Everybody wants to look good and feel good.
And we want now to get to the demonstration part of it. We want to get to see how the Hydrafacial machine works. Talk to us. The SMS line is 20268, and the call line is displayed right at the bottom of your screen. On Twitter, we are at Ebru TV Kenya, and the hashtag will always remain my doctor. Doc, let's get to it. Maybe you can start with the machine.
So lovely. This is the system, and this is the handpiece that we use to infuse material and suck everything out. So like the skin has oil, dirt, dust, sweat that is collected in the pores, and this blocks the pores. So first we cleanse and extract. After that there are certain infusions, and we'll go into this whole process. But first, Eunice is going to demonstrate how we actually take pictures of the skin before we start, because you want to see the results for a before-after. So a patient profile is made, and we get the age, the birthday of the person, the telephone number, and we have certain notes that are keyed into the system. Yeah. After that, as you can see, Eunice is now taking different profile pictures of different areas, problem areas, from the side. Yeah, and when she comes in for her next Hydrafacial next month, we're going to repeat the exercise of taking these pictures. So this is going to be able to tell us the state of the acne, the state of the oiliness, or the state of the dryness, if there's any pigmentation, is the pigmentation improving, if there's any fine lines and wrinkles, how are those being treated.
And what causes all those issues? And do you do only for the face, because there are so many other people with acne all over their body, or maybe these black spots as a result of some conditions like smallpox? Is it only for face, or do you have other machines that takes care of the rest of the body?
So the Hydrafacial treatment is only for the face, but in some cases we do it for the neck in certain ladies, because what happens is the face and the neck are linked. So sometimes you want to have, actually in most cases you'd ideally want to have your face and neck treated at the same time, because you don't want a difference in the shades. You can imagine looking very bright on the face and then looking very dark on the neck. It would look a little bit uneven.
Okay, I think Eunice, you ready? Yes, maybe you can take us through the first, Doc. Which is the first stage or step are we seeing here?
Okay, so the first step, what we're going to do is we're going to do a cleanse and peel. So we gently cleanse the skin and we exfoliate it. Yeah. What's
cleansing? What's exfoliating?
Yeah. So cleansing is where we clean the skin.
Okay.
And we have a combination of algae, lactic acid, and glucosamine.
Okay.
Yeah. And lactic acid was actually used from the times of Cleopatra in 3000 BC.
Okay.
Yeah. She would sit in sour milk, which had lactic acid, because of its properties of causing soft, supple skin.
So, Doc, maybe what's happening there?
Yeah. So Eunice is now cleaning the skin. There is a suction system which is sucking out all the oil, dirt, dust, sweat, chemicals, perfumes, cosmetics, and at the same time we are infusing the skin with vitamins, minerals, and antioxidants.
Okay.
Yeah. And then after that, what she's going to do is she's going to use a chemical peel.
Okay.
Yeah. So over here we have different chemical peels. We have a glycolic peel. We have a glycolic salicylic peel, and we have different concentrations. So depending on the skin type, the therapist, based on a review with the doctor, will decide on what chemical peel strength you want to use. Sometimes you want to use a very strong exfoliator, and sometimes you want something really mild.
Okay.
After that, there's also the Derma Builder treatment, and the Derma Builder treatment contains a lot of anti-aging nanopeptides.
Okay.
So what the anti-aging nanopeptides do is they infuse the skin and they prevent the anti-aging process, and they work on the fine lines and pigmentation.
Okay. And Doc, I can see what she's doing, maybe from the pictures that she's taken, maybe as an expert. What are some of the maybe problems or that you've been able to see with her, and that has maybe led her into using the kind of products that she's using right now on her face?
Okay. So for this, I would need to take a medical history before I can give you a full determination. But if the camera can just kindly zoom in onto her face, and then I should be able to explain what... Yes, that's perfect. Yeah. Now, if we look at her skin, we see that there is an acneiform eruption. Yeah, we have some white heads, we have some black heads, we have some pustular acne, and we have some cystic acne. She also has some seborrheic dermatitis. Yeah, she has some post-inflammatory hyperpigmentation, which is related to the dark spots that we see over here.
Okay.
She has a scar from a previous injury. She has a mole over here. Just for interest's sake, there's some eyebrow tattooing that has been done. And she has some tiny, tiny, tiny warts on the skin. Those are known as dermatosis papulosa nigrae. So all these are the conditions that are there. And if we are able to see, when we do this extraction, yeah,
Is it
you
painful?
you can actually see a collection of debris. So everything is being sucked out and being pushed out. And behind the machine, there is a collection tank.
Okay.
And if I can just turn the machine around very gently, yeah, then I should be able to show you how everything is collected.
Okay.
So over here we have a collection tank, and the procedure has just started, but all the fluid that goes in through the front of the system is then used for the cleansing process, and then all of it is brought back out.
Okay.
Yeah.
And Doc, one more question. This Hydrafacial process, how many times or how frequently are you supposed, as a person who you want to care for your skin, for how many times are you supposed to have this done on you?
Okay, now this is actually known as skin health for life. So just the way you go to the gym to build your muscles, yeah, you can actually do a Hydrafacial every month. And within 6 months of doing this treatment, you will see an amazing change in your tone, your texture, your tightening. You'll have a glowing complexion, and it'll help you feel more confident.
All right. And maybe, Doc, some of the skin conditions, maybe you can highlight it. I'm sure it's not only for that flawless look, but it takes care of skin, or Hydrafacial process takes care as well for, or prevents you from getting some of these common skin conditions, right?
So the Hydrafacial is used for the treatment of acne. It is used for the treatment of rosacea, which is a condition where you get redness of the skin. It is used for treatment of certain facial scars. Yeah. It is used for pigmentation. It can be used for melasma. It can be used for cloasma, post-inflammatory hyperpigmentation. And these are, it's the first step in any skin treatment.
Okay.
After this, what we can do is we can actually see most of the conditions we're able to sort out with the Hydrafacial. However, if advanced laser technology is needed, then that can also be used on the skin. We also have these wireless LEDs. I think Eunice will show them in a little bit. Yeah. So over here, Eunice is using a 15% glycolic acid and a 2% salicylic peel. Now what this does is this helps to firm the skin, loosen out all the whiteheads and blackheads that are collecting in the skin, open up the pores, yeah? Yeah, and this is applied with a dabbing technique, which was quite different from the long strokes that we're doing when we were cleaning the skin.
Okay.
Yeah.
And just in case you're joining us for the very first time, today on My Doctor Show, we are talking about some of the skin care routine. And I know you're wondering what's happening today. It's Hydrafacial process or demonstration or cleansing of the face. And Dr. Pranav tells me that it's very important because other than getting that flawless look as well, it helps you or keep away from those skin-related conditions. I can see your questions coming in, but remember, we'll be looking at them. Keep talking to us. The SMS line is free of charge, 20268, and the call line will always be displayed right at the bottom of your screen. On Twitter, we are at Ebru TV Kenya, and the hashtag MyDoctor. Maybe, Doc, we've seen Eunice finish the first step. I don't know what you had explained on that, and now she's using something different. Someone is asking how much per session, but we will be getting before that. But before then, maybe could you just take us through what is happening right now?
Okay. So we actually have 4 solutions. So we started with this one.
Okay.
And then after that, we're going to this one. The last one is a cleansing solution. And all of the treatments come with their own individual tips. Yeah? So this maintains the hygiene, because you don't want to go into a salon and they do a treatment on somebody's face and they have all these different skin diseases, and then they use the same tip on your face,
Okay.
and you could actually contract something while going for a beauty treatment.
Okay.
So now there's a combination of honey and salicylic acid, which gently exfoliates the skin. Yeah, and with this she uses a slight twisting process to suck out all the blackheads. So what we did with the first step was we loosened everything. When we were cleaning, we did a peel and that loosened the skin, opened up the pores, and now she's actually getting a painless extraction.
Okay.
Yeah. Now, if you remember, yeah, how they do these extractions, you can actually do that squeezing technique, which is a little bit painful, or they can use a comedone extractor, which is also painful. But as you can see, the patient is very calm.
Right.
She doesn't really feel anything. And a lot of our patients actually fall asleep
Right.
during the facial.
Okay. And Doc, maybe you could talk about the age bracket. What age bracket is it any age? Do you do this for kids, or what age bracket are you talking about?
The Hydrafacial can be done on children as young as 13 years old when they get their acne breakouts. And it goes all the way up to, so my youngest patient was 13 years old, and the oldest one was 82. So it can be used by any age group for any skin type. All we do is we change the ratios.
Okay.
So for a younger person, we may use less lactic acid, we may use a little bit more salicylic acid. Yeah. So it just depends on the age. And Eunice has been trained by therapists from the US.
Okay.
They came down, they did her training, and Eunice is actually our lead trainer.
Okay.
We do have constant training sessions for all the staff, where we get doctors and therapists from all over the world to come and teach the staff on best skincare practices.
And Doc, maybe you could now tell us, because you mentioned that you're supposed to get this at least once in a month. Maybe after you get this, what are some of the skincare routine, or after you go home, should you just continue? What should you use on your face, especially on your face? Should you just continue using your normal geisha or castles, or what should the routine now be like?
After the Hydrafacial, we do provide a customized skincare routine that is based on your skin. So if you have a dry skin versus an oily skin, your moisturizer, your serum. I'm not a firm believer in toners.
Okay.
I believe in serums more than toners. So we'd give you a moisturizer, and then, sorry, we'd give you a cleanser, a serum, and then a moisturizer, and then a night cream or some dark spot creams if you have any dark spots, if you want an anti-aging routine, if you want to glow. So like if you want to glow, you want products with vitamin C.
Okay.
Yeah, kojic acid, arbutin, licorice, these are going to be important for pigmentation. So a customized individual regime is made for you or tailored for you depending on your skin type.
Okay. And maybe the time duration for the whole process?
The whole process takes between 30 to 60 minutes, depending on the extent of cleansing work that needs to be done.
Okay.
Are we doing the laser therapy? Are we doing the lymphatic drainage? Yeah.
Maybe for her skin, what are some of the processes are we expecting, and maybe after how long do we expect now everything to be okay, or the process to be complete?
Yeah. Oh, within 3 days, she's going to see a huge difference in her skin. The skin is going to be glowing, and she's going to be quite happy with the results. Eunice, would you like to just show them how we do a lymphatic drainage? So we normally do a lymphatic drainage, and with this, when we've gone through a stressful period or not sleeping enough, we get a collection of lymph or fluid, which stays underneath the eyes. It causes puffiness, it causes dark circles. So there is a technique whereby we drain all this lymphatic fluid. We have the lymph glands over here, and everything is then gently pushed into circulation, and then this removes all the facial puffiness. A lot of people wake up in the morning and the faces are puffy, so the lymphatic drainage will help with that.
And someone has been asking the same question 3 times,
Yes.
and they're asking how much do I need to have maybe to get the whole process, you know,
Okay.
done? Maybe per month, or
So
you said it's a lifetime
yes.
thing?
Now normally what happens is it's 15,000 for a treatment. However, you can buy a package of 6 treatments for 60,000, and then you come every month. So then in that case, the cost is 10,000 per month to get this medical facial done.
Okay. And someone else is asking, where can I get you specifically, your location? Maybe you can answer that before we forget.
Yeah.
Yeah.
So we have 4 clinics. We're based in Mombasa, we're based in Uganda, and we're based in Nairobi at Yaya Center on the 4th floor.
Okay.
And Avenue Clinic is also in Parklands at Park Suites. And there is a very easy number to remember for the viewers. It's 0714
0714
500 500.
500 500. 0714 500 500.
Yes.
Very simple. And in case you want to have them or you want such services, then you know where to get them. You said in Nairobi it's at Yaya?
At Yaya Center
Alright.
in Kilimani, and in Parklands, Park Suites opposite the Parklands police station.
In Mombasa?
In Mombasa at Pandya Hospital.
Okay. Thank you so much, Doc. And keep talking to us. The SMS line is 20268. What is happening here, in case you're joining us for the first time, is just some of the skincare routine. And we are having the beautiful lady. There's Hydrafacial process that is happening right now with Eunice. And Eunice, I can see you still very keen on whatever you're doing. Maybe, Doc, you can now tell us how far are we?
Okay, so we're doing the lymphatic drainage. Obviously, I'm going a little bit faster with everything.
Right.
But the next step would be the anti-ox serum. But for the sake of going a little bit faster, now I'm going to show you the skin rejuvenation. And we have 2 different kinds of lights. Shall we show them the red light and the blue light? Yeah. So the red light is used for anti-aging.
Okay.
Yeah, so the red light is used for anti-aging and fine lines and working on pigmentation, while the blue light actually kills bacteria. So in her case, we would be using the blue light, yeah, and what this blue light is going to do is it's going to destroy the, yes, and it's just applied like that, 6 seconds on a spot on multiple areas.
Okay.
Yeah, so the Hydrafacial is one of the main systems that we use for the face. However, for people that may find 15,000 not too affordable, we also have other treatments like chemical peels that we can do for the face that would be at a slightly more cost-effective price. But the Hydrafacial still remains the gold standard in facial treatments.
Okay, and maybe, Doc, you could take us through some of the bad skincare habits. For example, is it okay to enhance your skin as a dermatologist, part of it or point of view?
No, as a cosmetic dermatosurgeon, I'm involved in a lot of procedures, from the face to breast enhancement to buttock enhancement to cellulite treatment to tummy contouring, weight loss. Yeah, some ladies have very big hips, some people have very flabby arms. Yeah, so all these are body enhancement techniques. One of the most important things is to make sure that everything is being done in a safe way. Yeah, there are actually copies of the Hydrafacial from China that are circulating in Kenya.
Okay.
Yeah, you have certain substandard products, you have fake products. So what I'm trying to say, it is okay to enhance your skin. It's okay to enhance your body. I mean, all of us, we like to feel good. We like to look good. I mean, you have a beautiful hairstyle. You could just leave your hair like that. That is also enhancement. Yeah?
Okay. Okay, and Doc, maybe because this is more professional, this one, I'm sure from your point of view, it will not have any bad or side effects on this particular case study that we are having today. Maybe, Doc, could you highlight some of the bad skincare routine that you observe, maybe from your clients?
Okay. Now, one of the things that we see a lot is people say that we have African skin, we don't need to use sunblock.
Okay.
So if there is one big take-home message that I would like everyone to go home with,
Okay.
is use sunblock. Yeah? Moisturizing is also very important.
Okay.
You want to use a moisturizer that is light if you have an oily skin, and if you have a dry skin, you want to use something that has a slightly thicker texture.
Okay.
Yeah? And then your skin is also going to reflect what you eat. Yeah? So diet is also very important. You want to have a balanced diet rich in antioxidants and vitamins.
Okay. And because we're winding up this first session of the show, someone is asking, what is the cheapest price one can pay, please? I think they really want to have this done on them.
Yes. So the cheapest price is 10,000 when they buy a package. Yeah. And it's an amazing treatment. I'm sure they'll be very happy with the results.
Okay. And maybe we can conclude with what Eunice is doing right now. Yeah.
So this is the LED phototherapy that we're doing. And this is going to actually kill the bacteria, yeah, called Propionibacterium acnes. So this bacteria is very active on the face in acne-prone skin. So this light is used to actually kill the bacteria.
Okay.
And what we have done with the suction actually helps the bacteria to come to the surface.
Okay.
So once you do the suction and then you do the light therapy, it kills the bacteria.
Okay.
After this, Eunice will do the red lights. Eunice, if you just want to show them how the red light works.
Okay.
Yeah. And what the red lights will do is they will work on any pigmentation, fine lines, anti-aging. Yeah, and it will cause biostimulation of the collagen fibers.
And Doc, just for a more emphasis on why this hydrofacial process is important, maybe could you highlight some of the face, because I know this is face-related, some of the face-related conditions that hydrofacial process, once it's done on you, then you do not have to worry about.
Okay. Now, the thing is that your skin, like your body, needs constant care.
Okay.
Yeah? So you are going to constantly need to take care of it. If you don't moisturize properly, you'll get wrinkles very early.
Okay.
If you go into the sun without sunblock, you're going to start getting sunspots. So there is no such magic such that you do the hydrofacial once or twice and your problems are gone. What we normally do is we say, do 1 or 2 treatments if you can't do the package of 6. And then after that, we will give you a specific tailor-made skin routine that is going to work hand in hand with the hydrofacial to maintain, prevent, and protect.
Okay. And Cynthia is asking, maybe in regard to what is happening right now, my face is full of black spots. Is this process also able to get rid of them?
Oh yes, absolutely. The only thing is that we need to do a consultation. We need to see what those black spots are due to. Sometimes it may help with the black spots, but if your condition is such that you require an alternative treatment, then so be it. But sometimes by going to people that don't have the right training in aesthetic medicine and aesthetic dermatosurgery, we may end up doing the wrong procedures, especially when we go backstreet sometimes to some of these spas that claim to do all kinds of wonderful treatments. They may not even know, because their understanding may be, this is a black spot. So this machine says it is supposed to treat black spots, let us do that treatment.
Okay.
And that can actually make things worse.
All right, and as we wind up, maybe, Doc, you could tell our viewers what are some of the do's and don'ts for a good skin care, or good skin care habit. What are some of the issues that they should never be done, either by ladies or men, and what are some of the things that you recommend should be the first thing in the list of anyone who cares about their skin?
Okay. So one of the first things that I would say to all those ladies out there is you need to avoid those mkorogos at Mombasa House that we are all very guilty of. A lot of ladies will not even confess to me, let alone their husbands, about these. But there's such toxic chemicals that are put inside there. Mercury and high levels of hydroquinone. So those can cause damage to the skin. You want to moisturize, you want to cleanse, you want to use good sun protection. Yeah, avoid picking the skin. get regular facial treatments by a qualified therapist or practitioner, and yeah.
Okay, and that's all the time we had for the first part of My Doctor Show. Thank you so much for this wonderful session that we've had with you. Dr. Pranav Pancholi, maybe you can directly say where are you, is it a clinic or where you're based once again for our viewers to get to know how they can contact you?
Yeah, so we're located at the Avenue Clinic, which is on the at Yaya Center on the 4th floor, and in Parklands at Park Suites. And the contact number is 0714 500 500. I'll just repeat that, 0714 500 500. Thank you very much.
All right, thank you so much. And we now taking a very quick breather, and when we come back, remember we'll be having now Caroline Ndaradhi, and she will be taking us through some of the home remedies for skincare. So just stay with us. Keep talking to us. The SMS line is free of charge at 20268, and the call line is displayed right at the bottom of your screen there. On Twitter, we are at Ebru TV Kenya, and the hashtag #MyDoctor. We are back. Welcome back. You're watching My Doctor Show, and today we are talking about some skin care routine. Remember to talk to us. The SMS line is 20268, and on the first part we just had Hydrafacial process being demonstrated right here, and on this part we will be having Carol Ndaradhi. She will be taking us through some of the home remedies for caring for your skin. She will also be taking a look at your questions, so keep them coming. But before we start, let's have a look at some of the home remedies for skin care. Watching My Doctor Show, and today we're talking about skincare routine. And on this second part of the show, remember, we will be picking your calls live, so just call us through the number displayed right on your screen. We will also be looking at your SMSs. 20268 is the number, and in studio now joining me is Carol Ndaradhi. That's right. Yes. She is a dermatologist as well, and we are continuing with this discussion. We are glad that you came early and you're here during the whole process. Maybe, Doc, you can now take us through some of the skin disorders for bad skincare habits.
Okay, thank you for having me. So when we talk about, so your question is regard to probably what skin problems happen.
Yes, or maybe you can start with what skin diseases or skin problems are, and what are some of the, what do we mean by skincare routine?
So skincare routine would entail cleansing your skin, how you wash your skin in the morning, how you moisturize, what you apply on your skin, and also, you know, taking your skincare also entails what you take, if you exercise, how you take care of your skin after you exercise, what your dietary habits are. For example, if you smoke or if you take alcohol excessively, that of course will also have an effect or impact on how your skin
and
looks
this is
like.
not just the face, the whole,
Yeah.
we're talking about the whole body,
Yes,
right?
the whole
And what
body.
are some of the skin conditions that we have right now? I know there are so many.
Yes,
but
there are
which
so
the
many.
common ones?
The common one, of course, which people always talk about is acne, where people present with these pimples that they get either around their periods or when they become, when they're adolescents, or things, if probably we start from the younger age group going up, you can have children who have eczema, which means their skin is quite sensitive to the acne, to skin problems that arise as a result of probably wrong skincare habits, or people using skin products that are not medically approved to brighten or lighten their skin.
Okay, and Doc,
Yes.
do we have permanent skin conditions?
When you say permanent skin conditions, permanent would be in the sense that probably this is something that the patient was born with.
Yes.
So for example, things like birthmarks, those are things that you probably would say are permanent, but some may be treated, like if you want them removed for cosmetic purposes, yes.
And let's maybe pick a few questions. Someone is asking, let me see, I had pimples, but zinaisha, zimeisha, imebak black spots.
Yes.
What routine should I now use?
So for that person, what I would recommend, primarily they should use a sunscreen. And the sunscreen that we usually recommend is a sunscreen with a sun protection factor of a minimum of 30. So when you go to the supermarket, you'll probably find sunscreen written SPF. So SPF stands for the sun protection factor. So it should have a minimum of 30 and above. Then, of course, it also depends on the type of skin that you have. So there are sunscreens that are better for people who have sensitive skin. There's sunscreen that is better for people who have oily or acne-prone skin. So if you visit your dermatologist or a doctor, they could advise on which is the probably a good formulation for your skin.
Okay.
Then, so that's the first thing. Then you can see a dermatologist to advise you on how to exactly probably remove those dark spots. Because if you say you have dark spots, you are not sure whether those dark spots were because of the acne that cleared, or probably you had also another underlying problem.
Okay.
Yeah.
And Doc, someone else is asking, Barbara, and I have pimples. I was affected by some medicine. Maybe she reacted to some medicine. What can I do?
So if you did react to some medicine, again, you have to come for assessment, because the level of pigmentation, how dark your skin is, the level at which it is we need to assess whether it's superficial or it's deeper, because then that guides the treatment option that you'll choose. In the market, there are some topical creams that people can use to help clear the dark spots. And again, what I would advise her is also to make sure she also uses a sunscreen in addition to her other skincare.
Okay, and we have Linda who is calling us from Embakasi. Hello, Linda. Hello, Linda.
Hello, how are you?
Hi, we okay, and you?
Also good. I'm asking what can be done on the skin concerning the hormonal imbalances.
Okay. Thank you. You've heard, huh?
Yes. Okay, thank you, Linda, for your question. So in regard to hormonal imbalance, it depends on we have very many hormones, and it depends on how her skin is manifesting. Because there are different ways, depending on what hormonal balance you have, that your skin will manifest. So for example, the one that I'll tackle is probably acne, because people think that acne is because of an issue with an hormonal imbalance. Not everyone with acne has an issue with hormonal imbalance. So I think that is something that should be clarified. But if you have tests that have been done, blood tests that have been done, for example, a condition I'll pick is a condition called polycystic ovarian syndrome, where people present with issues with their hormonal balance, such that people have irregular periods. So that means your periods don't come every month. And then they also have cysts in the ovaries. Sometimes they may have hair on the face. So if you have that, there's medical treatment that you're given to help balance the hormones, and then in addition now manage the skin manifestations, which is the acne that you have. And sometimes that hormonal treatment also sorts out the acne.
Right.
Yes.
And Doc, maybe you could do we have some natural way of taking care of your skin? Someone was asking about avocado, someone was asking, do we have some homemade
things,
ways of taking care of your skin?
Okay, now when it comes to homemade things, it is I would say it is 50-50. But what I will notice, sometimes some of the products that are available commercially are actually, you'll find some are fruit-based. So basically, those fruits have enzymes, and those are what work on the skin. But when we come to saying, because people say they will use turmeric, honey, things like those, we cannot say, there's no scientific backing to say this. If let's say you have dark spots, use turmeric at this ratio, because how do you determine how much of turmeric to put, how much of avocado to put, or using the face masks and things like those. But there is a role for natural treatments, because some of these products that are cosmetically made are based from some of are plant-based or fruit-based products.
Okay, and
Yeah.
Doc, what you do, there's so many YouTube channels, so many apps
Yes.
on getting rid of especially acne and getting that flawless look. First, because most of them, they'll tell you how you can mix honey with turmeric and so forth for, if for example, you want a glow skin, you want flawless and
Yes.
all that. What
Yes.
should you tell of them?
Well, some do work, as you saw probably from the first session. There are some products that use the honey, because honey has some antibacterial properties. It also helps with the glowing of the skin. So some do work, but what I would advise, you would have to come in for an assessment to say whether this, because some people, if let's say you have acne-prone skin and you're using things like olive oil or coconut oil, those already you have oily skin, and if you add those oils on your skin, they'll probably clog your pores and make you get more of those whiteheads and blackheads. So it's not, you don't listen, and probably people use this black soap and shea butter, but you see it also depends on what your skin type is. So some may actually some people come to us after having used those remedies and notice that their skin, unfortunately, probably is becoming worse rather than becoming better.
And Doc, other than these illnesses that may lead to or may affect, let's say, smallpox, that maybe you may end up having some black spots. What are some of other ways, other than those medical-related ones, that can contribute or or are the key contributors to someone's bad skin, especially the face?
The face. So it'll start from probably, so we start with what you're taking. What is your diet? Do you eat healthy? Do you make sure you eat at least fruits and vegetables every day? Do you hydrate adequately? What are your social habits? Are you someone who drinks excessively? Do you smoke? Because smoking generally is definitely not recommended.
Okay.
Other for your skin or your general health.
Okay.
Yes.
And we'll be looking at do's and don'ts, but before that, let's hear what Elsie is saying. Okay. Elsie from Machakos is calling us. Hello, Elsie. Elsie.
Yes.
Hi.
Hi.
Kindly talk to us. What's your question?
I would like to ask, how can one manage acne during pregnancy?
Okay. Very important question there.
Okay.
Acne
Thank you,
during
Elsie, for your question. Yes, you can have acne during pregnancy. The only thing other than as we said, hydrate your skin, the normal skincare regimen, make sure you use a sunscreen and an appropriate moisturizer for your skin, which people with acne tends to be oily. There is medical treatment for acne in pregnancy. However, what is important to note that during the first trimester or the first few weeks when your organs are being made, their medication, of course, you will not opt to use oral medication at that point, though there are topical creams that can medically be used if you are pregnant. For patients who have very severe acne, which is probably causing a lot of scarring, they have cysts and they have big pimples in their face, or if you feel the skin, you feel very big pimples, some are probably discharging some fluid or pus in them, you may opt to use oral medication, but that is usually reserved probably for the second or third trimester. And if they are used, they are not used for more than 2 to 3 weeks. Okay. But there is treatment that can be done if you're pregnant.
And what can I use to remove facial hair, especially on the upper lip?
The best way to get rid of that hair is to have laser treatment, because that will permanently sort out the hair. That will be the best, because though you can do, some people sometimes bleach the hair to make it look like the skin tone, or they try to shave off the hair. The only problem, if you do that, the hair grows more coarse. It's harder than how it was before. So if you want to permanently sort it out, the best way to go about it is through laser.
Okay, and we have someone else on the line. Sophie. Hello, Sophie.
Yes.
Hi, how are you today?
I'm fine.
Yeah, talk to us.
Okay. The problem
Yes.
is you have an oily skin. You never applied any oil on it.
Okay.
And you still have the difference.
Okay. Sophie asking about
Yes.
something very important.
Yes.
Oily skin. First, we can get to her, and then maybe you can differentiate for us. How do you get to know that you have oily skin or even dry skin, and how do you go about each type?
Okay, so in regard to her question, anyone, whether your skin is oily or dry, you still need to moisturize your skin. That is very important. So what you need to find out is, a moisturizer for your skin type. So for example, if you have dry skin, you will need a heavier cream because your skin gets dry quickly, as opposed to someone who has oily skin, who you'd probably opt to use gel-based products or cream-based products. But everyone, whether your skin is oily or dry, needs to use a moisturizer. Regarding how to tell whether your skin is oily or dry, that would be an assessment need. But by yourself, people who tend to have oily skin, after, if let's say they apply whatever they apply during the morning after they wake up, after some time they'll notice either their face is very shiny. If they wipe their face, they'll see some oil on their skin. Then as opposed to probably people who have dry skin, irrespective of what they apply, probably they even have to find that they have to apply petroleum jelly so that their skin does not look ashy or dry or scaly.
Okay, and we have another person calling this time around, a guy.
All right.
Let's hear what he has to say.
Okay.
Hello, Austin.
Hello.
Hi, how are you?
I'm fine.
Okay, talk to us, please.
My question is best product used with SPF.
Okay.
Okay.
I think he's done.
Yes.
He's asking about the product that you were talking about.
Yes, the SPF.
Yes.
So SPF stands for sun protection factor. So when you're buying a sunscreen, you'll notice that they have different numbers on them, SPF 15, 10. So personally, we recommend, because we're in the tropics and because of this issue of global warming, usually recommend that you use at least a sunscreen with a sun protection factor of 30 and above. So just to be a bit more scientific, that is a factor of, so when the sun rays are produced, you have something, we have UV, what we call ultraviolet A, ultraviolet B and C. So when you buy a sunscreen, you should make, so the sun protection factor is a factor of ultraviolet B. So in addition, whatever sunscreen you buy, at the back of it, you'll find something written UVA, which is ultraviolet A. And it usually has stars on them. So usually recommend that whatever sunscreen you buy should in addition have those UVA stars of at least 3 or 4 stars.
Okay.
Yes.
And someone else is asking, what is the correct type of soap to use for your skin at home?
So it depends. Again, it goes back to the type of skin you have. You notice that people who have oily skin, for example, there are some products or chemicals that you look for in the soap. And when you talk about soaps, it could be the bar soap, or it could be what we call these gels that people use to wash their face. Okay. Some tend to be milder, some tend to have less harsh ingredients in them. And probably even when you're using a soap, probably use one that is written moisturizing bar soap. So that, for example, the soaps that you use for washing, what we commonly see, some people use soaps to wash their, whatever they're using to wash their clothes, the bar soaps. Then we notice that they use them to also wash their bodies. The only problem with that is that you tend to really dry your skin a lot. So we recommend that you use at least a moisturizing bar soap, or you use those cleansing gels, depending on the type of skin that you have.
Doc, just to make us understand, we have the most common types of soap that you will get in every home. Like we have Dettol, we have Protex, we have Geisha and all that. What would you tell of them, Doc? Because many people use them. Is it okay, or do they contribute big to someone's skin?
Yes, they do. For example, patients who have sensitive skin or skin that is prone to a condition called eczema, usually we advise them not to use the bar soaps, or use the medicated soaps, because they tend to cause more irritation and make the skin drier. Yes, but some soaps are fine to use. And I usually say, if you're using a soap and you notice your skin is not having an issue, then some you can continue using. But again, if you have sensitive skin, probably avoid soaps that tend, or those herbal-based soaps or antibacterial-based soaps.
Okay, and we have another caller, Chris from Nairobi. Hello, Chris. Chris, hello.
Hello.
Okay, Grace, sorry. Go ahead, please.
My question is, I was told I have allergies, so I have pimples on my face.
Okay.
And I was told to use milk or goat milk products.
Okay.
So I'm asking, what can I do for the pimples to clear? Because it has been for some time now.
Okay.
Yeah.
Thank you, Grace. You've had her.
Okay, this I didn't quite get her.
All right, she's talking about she's somehow allergic, and so she's tried so many products to clear her acne, but it's not working. Maybe you can be more specific and try helping her, because she sounds really disturbed.
Yes. Now, the thing is, I don't know whether she sought over-the-counter treatment for her acne, or she saw someone medically for them. Sometimes the acne medication that is used, the medical treatment can be drying to the skin. And in that sense, then sometimes in addition to that treatment, usually we also advise on using specific, like a moisturizing soap or cream moisturizers to avoid that dryness that patients get. But in regard to her skin, what I would advise her, it would be best if she came for an assessment to see, so that you can advise her on find out what she was using or what she has used, and then now move from there and advise on what she should use.
Okay, and someone else is asking about the best soaps to use, and you've talked about that. Maybe, what can I use to remove facial hair? I think you also mentioned that.
Yes.
And for the SPF, can one get from the supermarket?
Yes, yes. They are very readily available.
Okay.
Yes.
And Doc, maybe you can now tell us, how do you get to determine, because you've talked about for you to use any moisturizer or any product on you, especially your face, you have to get to know what type of face are you having. So how do you get to know that, I have oily skin, I have dry skin? Is there a way you can find out, or you have again to see a dermatologist?
No, even you yourself, you can tell. So if you have oily skin, if probably after some time you notice your skin is shining, if you wipe your face, you see that it has a lot of oil, then probably you have more of an oily skin.
Okay.
And when it comes to that, probably you want to use cream-based products, not use oil-based products, because sometimes you'll find people who have oily skin are using Vaseline or using now these natural oils we're talking about, like olive oil or coconut oil, and then those tend to add more. You're adding more oil, which tends to block your pores, and if you have acne-prone skin, it makes your acne worse. But if you have dry skin, these are people who, despite applying, let's say, whatever cream they apply, after a few hours, they notice my skin is still dry, it looks ashy, it looks gray, it's still peeling. So those you tend to use heavier. You can use now those oil-based products or use heavier creams to moisturize the skin.
Okay, and as we wind up, Doc, just give us a few tips on better skincare routine and maybe the do's and don'ts. What should completely be avoided for a person who wants really to have that good skin and to avoid all those skin-related conditions, and maybe for ladies that flawless look? Yes.
So first of all, let's start from within. So it depends on your habits. Are you eating, having a good intake of your fruits and vegetables? Are you hydrating well? If you're smoking, you'd advise that you totally stop smoking. If you exercise is definitely a good thing to incorporate. Then now coming to your skincare regimen, how are you cleansing your skin? So commonly people say that they use face towels to wash their face, but I usually tell them especially if you have acne on your skin or if you have pimples on your skin, if you use a face towel or something to scrub the skin, you tend to make the irritation worse. So you recommend that you just use the soap and your hands, and then you just gently use circular motions, gently around to wash your face. That is in regard to cleansing your skin. Then, of course, use a good moisturizer. Make sure you use a sunscreen. Sometimes you do recommend serums, depending on whether you're looking for more of the anti-aging aspect or if you have acne. So those can be used.
Okay, Carol and Aravi, thank you so much for bracing us with your presence on My Doctor Show today. We do appreciate. Unfortunately, that's all the time we had for the show. It was really informative. We look forward to having you once again. Yeah, and that's all the time we had for the show today. Thank you so much for keeping us company. Thank you for your calls, for your comments. Remember, this show continues tomorrow, talking about different things. And I can see your SMSs are really coming in fast. But we have Carol here with us, and she will be responding to some of your concerns. Someone was asking the number for the previous doctor. It was 0714 500 500. You can always download the previous episodes from our YouTube channel on Ebru TV or on Purity Museo. Always look for My Doctor Show. Have a lovely day. My name is Purity Museo.